Hello, ATG, and good afternoon. This is 2021 back at the Salah edition at AsktheGynaecologist. I'm just trying to check my speakers here that my audio is good. Once again, I want to say good evening. This is Dr. J at Ask the Gynecologist, and today is Tuesday. I know most of our members that are Muslims are having fun time, are having a swell time in Nigeria and wherever you are in the world. Today is the Muslim celebration day for Salah, and I'm praying that by the grace of God, our prayers will be answered. Once again, I want to say my name is Dr. J at Ask the Gynecologist, and I'm happy to be here tonight with you. We are broadcasting simultaneously on Facebook here and on Instagram, and also we are recording for publication on YouTube. I know I've been busy these days. There's nothing I can do, but I would love to be here all the time. Once again, I want to say it's always my pleasure to be here. And today I had the pleasure of, rejoicing with another lady. And this lady just sent me a text all of a sudden today that she's been trying for years. She wanted to go for IVF. After I consulted with her, I looked at her result. I told her that, madam, you don't need IVF. You just need to have regular sex. And you should include using pre-seed in your sex. Pre-seed is a lubricant that we talk about here all the time. And our first time of having sex with pre-seed lubricant, she got pregnant. And in fact, pre-seed also enhances enjoyment of sex, and her husband enjoyed that sex. It was amazing for her. And I can tell you something, pre-seed works for a lot of people. And if you're trying to get pregnant, you should try and use pre-seed. The things we say here are not our own making. They are facts and they work, and they've been working, and hence we continue to say them, preach them, and shout them on the mountain. He who has an ear, let him hear what we say here at ATG. So good evening to you all. Sit down. Today is going to be an open session, and I'm going to take questions as much as I can. The weather in UK is the hottest in a long time. I've been in UK since 2000 and long time, and I've never seen such hot weather in the UK. The weather is about sweltering 31 degrees today. I've been sweating, and in fact, all windows open in my office here, and it's hot like anything, like Lagos, Nigeria hot. So once again, I want to say welcome once again. It's been a long time. I want to say happy Salah to all our Muslim members. Happy Salah to you from ATG to you all. God bless you. So let us start and open this session. It's going to be an open session. So please, as I answer questions, listen to my answers to questions. And once I'm answering questions, you probably learn a lot from what I say regarding other people's answers. So listen, okay? For those asking for my numbers, okay, there's no way on earth that I'm going to give my number here live on ATG. Reason is that even the people that who see my phone will buzz that I will not sleep. I'm human. I have to rest now. I have to sleep. I'm human. I'm still a man. You see, so for you to get in contact with me or to us at ATG, you can always subscribe to the ATG services, the ATG premium services. Subscribe to it, and one of our team members will get across to you, and you get my number and you can consult with me. We have many services available at ATG. We have the antenatal services for those who are pregnant. We have the GTC for those trying to get pregnant. The antenatal and the GTC are on they are on Telegram. Antenatal is antenatal group. GTC is getting ready to conceive. They are all on the Telegram groups, an open group, so you can ask questions openly. But if you want one-to-one discussion with me, you have to go to the premium services, which is we have the weekly consult, the monthly consult, the gold consult, the diamond and the platinum video consult. All these links will be shared with you now on this page. If you're watching on Instagram, we cannot put up all the links to our services on Instagram because Instagram does not allow many texts. So just send an email to atgservices2018 and somebody will get across to you. I'm going to type the email address for our services. So if you want to reach out to us from Instagram, just use our email atgservices2018@gmail.com. I've already put the email on the screen, and somebody will reach out to you and they will send you all the links to our services. A lady in America, in Florida precisely, reached out to me through Instagram here. I don't know. She said she saw my video on Instagram, and she reached out to us on our email, and I shared with her the link to subscribe and here, and we are already consulting with her, and she's noticed so much change in her life, in her sexual life. So this lady reached out to me today, this new lady from Nigeria. She's been trying to get pregnant for years, and it's been a difficult time for her. She was thinking of IVF. I said, don't worry, don't think about IVF now. All your tests are okay, and we went through things, and today she's pregnant. And I think I got another similar text earlier in the week with the same comment. Somebody as well got pregnant as well. When people get pregnant, it gives me so much joy. It gives me that joy. I don't understand. It's a feeling that we are making changes. We are making changes one lady at a time in families of people, and people are getting better. Their lives are changing. Somebody said, doctor, I tested positive. When is the right time to start prenatal vitamins? You should start prenatal vitamins even before you get pregnant. You should have been on prenatal vitamins at least 3 months before getting pregnant. And we preach that all the time on ATG, that if you're trying to get pregnant, you should be on prenatal vitamins at least 3 months before getting pregnant. And you should take these vitamins 3 months into your pregnancy minimum. So you should be on prenatal vitamins 12 weeks before getting pregnant and 12 weeks into your pregnancy. Okay, so if you're not on prenatal vitamin, start yesterday. Pamelo, start prenatal vitamins since yesterday. How many cycles can one try before achieving pregnancy if using the fertile window as the only option? If you're using the fertile window only as the only option, your chances of getting pregnant is only 30%. Using fertile window for sex alone gives you chances of getting pregnant only 30%. As I preach on ATG all the time, to get pregnant, you should have regular intercourse. Regular intercourse is precisely sex every other day. Worst case scenario should be sex every 2 or 3 days. By doing that, you're going to have sex whether you're ovulating or not. The only time you're free from sex is during your ovulation. I'm sorry, during your period. Apologies for that. The only time you're free from sex is during your period. Every other time is bars goes bars. It's bumper to bumper. It's pants up, pants down. You should have regular sex every other day. By doing that, you should get pregnant. If you're doing regular sex and you've done that for at least 1 year and it's not happening, try for another further year. If you've done regular sex for a minimum of 2 years and you're not able to get pregnant, then it's high time to start doing infertility tests and all that. That is if you are less than 35 years old. If you're more than 35 years old, 1 year of regular sex, nothing happened, you should start infertility investigations as soon as possible. That is why you need to be under a guide of someone like me that can give you advice and go through your results and tell you the truth and the best opinion. Many doctors in Nigeria, they know what they're doing, but the thing is that if they don't tell you what you want to hear, you probably go to where you want to hear what you want to hear, and they'll lose customer base. So they will always tell you what you want to hear. Many doctors in Nigeria also learn, know, and do what we do here in the abroad. But the thing is that there is private healthcare system in Nigeria, and if they don't tell you what you want to hear, then you're going to move to where you want to hear what you want to hear, and they will lose their own customer base. So they will try and keep you as long as possible. If you meet a doctor like myself, by grace of God, that is ready to tell you the truth, not strings attached, my sister, thank God. And let us work together to make your story happen. As you well know, our ATG IVF Center is open since June 1st, last month, and we are thriving. A step at a time, one lady at a time, we are making changes to people's lives, and we are moving and we are taking massive strides consistently. Lives are changing, people are getting pregnant. It's high time you register at the ATG IVF Center. If you want to get pregnant, if you've been told that you need IVF to get pregnant, the best place to go is the ATG IVF Center. And if you have issues with infertility, you're not able to get pregnant, you want to do your test, or your infertility test, in a reliable place, a reliable environment, please go to the ATG Laboratories. Close to ATG Laboratories is also together with the ATG IVF Center, and we'll do all your infertility tests there, and we'll give you the results which are genuine, sound, and certified. A question here on Instagram: what causes hot in the vagina and white discharge? That is usually thrush or vaginal yeast infection. So get it treated with canesten. There's a question here on Facebook. It's gone. Jesus Christ. Oh my God. Says, thank you, sir. In my previous pregnancy, I was already having all the symptoms, such as vomiting and all, but I haven't done any. Is that normal? you don't have to have vomiting and all these symptoms to confirm pregnancy. If you're pregnant, you're pregnant. Some people will have vomiting and all those symptoms in early pregnancy. It disappears when they are 12 weeks onwards. Some people have vomiting issues and pregnancy symptoms all through pregnancy. Some will not have it at all. Some will have it only towards the end of pregnancy. So having the pregnancy symptoms is nothing. It's not a big deal, okay? So it's nothing. If you have it, well and good. If you don't have it, rejoice and continue and enjoy your pregnancy, okay? All right, let us scroll down here and look for questions. If you're trying to get pregnant and you're having regular sex, always include pre-seed lubricant. Pre-seed lubricant is a very, very good thing. It makes sex palatable, makes sex enjoyable, and also enhances chances of getting pregnant. Pre-seed, P-R-E-S-E-E-D, okay? Get it. So get it. Pre-seed, pre-seed, pre-seed. Let us write it here on Facebook. Pre-seed. Pre-seed lubricant. So get the pre-seed lubricant. It helps and makes things happen. I hope you can see that on Instagram, and people watching us on YouTube can also see that as well. Thank you, Nkechi Grace Stephen, my wonderful sister. She's been on my podcast last year or so. Was it early this year? I think it was last year when we started the MindMasters series podcast. Doctor, good evening. Please, how do you ovulate? How do you do ovulation look like and symptoms? My God, when am I going to win this battle? People focus too much on ovulation. And what I mean is that they focus too much on the ovulation signs and symptoms. My sister, the only true guide that will tell you if you're ovulating is if you have a regular cycle. If you have a regular period, regular cycle, your cycle is plus or minus 2 days is regular, okay? So plus or minus 2 days regular, and it's bang on the buck. You are ovulating almost 90%. And if you want to know if you're ovulating, do your D21 progesterone test. As far as you're ovulating, don't wait for all those egg white nonsense. Waiting and looking for egg white is total baloney, total badadash, total baloney. It's a waste of time. Look, people getting pregnant today, following us, they don't wait for seeing or to see all those egg whites. They don't wait for it. You see, if you want to wait for it, you're going to wait in vain and you're going to spend money for nothing. What you should do is seriously work on this and listen to me. It works for people. By having regular intercourse every 3 days, let's say worst case scenario, every 3 days, sex is not only for pregnancy. Okay, if you cannot enjoy sex while trying to get pregnant, you probably not enjoy sex even after pregnancy, okay, or after the children are gone. If you can't enjoy sex, seriously speaking, before getting pregnant or while you're trying to get pregnant, you're not going to enjoy sex even after the children are born. That means that you're just waiting to get babies, and those babies will probably tear you apart. Babies are not supposed to put your marriage together. Your marriage should be formed already. Marriage is between you two. Children are only a product of the marriage. They're not part of your marriage. Marriage is between two of you, man and woman, or whatever it is you call it. But children are only fruits. They will go away and go and start their own marriage somewhere. Children are not part of your marriage. Okay, they only make your marriage colorful. Let me tell you the truth. So the first things first is that learn to enjoy sex with yourself. So as per getting pregnant, looking for ovulation sign is a waste of your time. As far as you have a regular period, you should be having sex at least every 3 days. By having sex every 3 days, okay, you're probably going to get pregnant faster than somebody looking for ovulation signs, looking for all those egg whites, looking for all those smear, all those nonsense. It's a waste of time. Get on the ball, get jiggy, get gbas, and shift the womb self and do the thing. As far as the sperm is okay and your egg are releasing egg, you're gonna get pregnant. And there's no blocked tube, you're gonna get pregnant. So if you're waiting for ovulation time, well and good for you. You're only waiting to get pregnant only 3 out of every 10 times. So, but ovulation signs, you see egg whites. You can use it, you can even do your clear blue sign, looking for 2 lines. That's it. There's a question here. Doctor, my FSH is high, 25. How can you lower it? Okay, now, Ogundakwa Temetayo, let me tell you the truth. And please listen to me, so that you don't let people lie to you. But if you don't want to listen to me, you can also go and get a second opinion. I appreciate that. When I say get second opinion, I'm not saying that I don't like you or you don't trust me. It's a fact of show of respect and humility by the grace of God. No doctor and no person knows it all in this world. So let me give my opinion on FSH. As I always say here on ATG, right? People watching me, they can write it down. Please listen to me. FSH is the hormone released from your brain that goes into your bloodstream and then it goes to your ovary to tell your ovary to release egg. If your FSH is more than 30 on 2 occasions, and those 2 occasions are at least 6 weeks apart, your FSH is more than 30, it means that you are likely not ovulating again. Okay? If your FSH is more than 30 on 2 occasions apart, and those 2 occasions are a minimum of 6 weeks interval separated, that means your FSH is saying that you're not ovulating again in most cases. That is why if people come to me, FSH is 32 or 25, borderline, I will always tell them, repeat your FSH 6 weeks afterwards. If it's more than 30, 32, 35, 40, 45, on 2 occasions apart, I'll tell you you're likely not ovulating. Now, I've seen a lady come to me, FSH was 45, we checked it again, it's back to normal within 6 weeks. So for such a person, I won't say that she's not ovulating, okay, because it's back to normal within 6 weeks. But if yours is more than 32, more than 30 on 2 occasions apart, you're likely not ovulating, as far as you're not taking any other hormonal supplement or anything like that, okay? Now, if you're not ovulating anymore, there's nothing anybody can do. That's the honest truth. If you're waiting for someone to send you some medication to boost your egg reserve, to restock your exhausted eggs, welcome to the world of Facebook. People will dupe you anywhere to collect your money. Say, go and take this, go and take that. In fact, if I tell people here this night to go and mash some orange juice, pour some atari inside, some tiger pepper, and say, fua, 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 they'll get pregnant. People will do it. And people will come and give me money. That is how people are so gullible, because people are under duress and under stress. But I hope my heart, because I'm a graduate of medical school and I'm trained in orthodox medicine, that is medicine of the Western world. I don't know about osteopathy. I don't know about other medical stuff in other way. I tell you what I know. If your egg supply is exhausted, you cannot replenish it. It's gone. The next thing to do is to consider IVF with egg donor. So I'm going to interpret your FSH for you 25. There's nothing I'm going to do about that now. What I'm going to do is I'm going to tell you to repeat it again 6 weeks after the last test was done. And then send the results to me. You can send it to me through ATG Premium Services, and I'll go through them and I'll give you feedback. There's a question here. Doctor, in case of husband having low sperm count, if your husband has a low sperm count, we give them Adizua, we give them Proxid to use for at least 8 weeks and see if that Proxid or Adizua will boost their sperm count. Even we can even get Fertility for men. And we check your sperm count 8 weeks afterwards. In most cases, it will go back to normal. But if it's not going back to normal, what we can do is to consider IUI. If the problem is just only low sperm count and your wife is ovulating, there's no blockage in the tube, we do IUI. IUI is basically if the man has problems. Okay, so that's solution to low sperm count. If the sperm count is not coming up after all this adventure of Adizua or Quickseed or whatever, then we have to consider doing the testosterone and trying to see if we can get some sperm, and to see if the man is producing sperm. Maybe there's just a blockage and the sperm can't come out. In such a case, we can go and try to aspirate sperm, what we call testa-persa, from the testicles to get you pregnant. Now, somebody is saying, I don't ovulate. That is from Soko Ibrahim. You want to get help. How do you know you're not ovulating? What test have you done? So let me tell you how I'm going to help you. You send all your results to me through the ATG Premium Services. I'll go through them and I'll tell you the honest truth about your results. So Norakums Nankwat Sokok Ibrahim, send your results to me. Is it lovely? Doctor, how many times can one take Clomid? If you're being given Clomid by a doctor that knows what they are doing, by the time you're on your 4th and 5th Clomid cycle, they should start thinking of IVF or stopping that nonsense. Nobody should go past 5, I would say 6 Clomid. But don't treat yourself with Clomid so that you don't destroy your ovaries. Clomid too has a way of destroying ovaries. If you're going to take Clomid, you should be under care of a doctor that will do follicular tracking and ensure that you're not destroying your body. And we start with the lowest dose. I can't say more than that. Battling with infertility, for almost a year now, you have milk discharge from your breast. What can you do to restore fertility? So if you're having excessive milk in your breast, there's a chance, a possibility that you might have high prolactin. If it's indeed true that you have high prolactin, then we need the result, okay? Because at least if we start you on treatment to bring your prolactin down, we should have a baseline what your prolactin is or was before we start the treatment, so that we can monitor your prolactin and see if it's responding to the treatment. And if it's not responding to treatment, we might need to give you some medications to bring it down, or add some other medication, or entirely change your medication. So we need to know what your prolactin is before we start medication. Well, that's number one. Number two, we need to do your other hormonal profile, FSH, LH, day 21 progesterone, testosterone, thyroid hormones, to know if there's any issues with them. Go to ATG Laboratories, get your hormonal profile done, and send it to me. Once you do your hormonal profile, the ATG Laboratories, Nike or any of the lab members, the lab staff there, they will give you my link to send all your results to me, and I'll go through them. Someone is saying, doctor, what is the best way to get rid of ovarian cyst? You did surgery 2018, now it's happening again. Now, the best way to get rid of ovarian cysts is to remove them surgically. That's the honest truth. In most cases, 80% of the time, ovarian cysts less than 4 centimeters will disappear on their own. But if you have ovarian cysts more than 4 centimeters, 5 centimeters, you've scanned it again in about 3 months' time and it's not going, then we have to remove them. In most cases, ovarian cysts will disappear on their own after 3 months follow-up. They will go away as far as they are less than 4 or 5 centimeters, okay? Good evening, doctor. What is the cause of after sex sperm come out? The law of God. People ask questions, okay, why is sperm coming out after sex? Ask God now. God created gravity. It's the law of gravity. If I have sex with my wife and she gets up, sperm will pour down. If any pastor in the world, even the biggest pastor, have sex with his wife and she gets up, sperm will come down. It is the law of God. It's the law of life. It's the law of the world. It's the law of physics, gravity. Okay, what goes up will come down. If you like, hang your leg and tie a rope and throw it to the rocket of Jeff Bezos. If you get up out from the bed after sex, sperm will what? It will pour down. Sperm will pour down. It's normal. What you need to know is that, is your sperm of your husband okay? If it's of good quality, it will get you pregnant. Case closed. Doctor, what advice can you give a couple on long distance relationship trying to conceive? What advice? Is for you to have regular sex now. And if you have regular sex, it's not coming out, you know, some people will say, okay, because you live far away, maybe you should come to each other whenever you're ovulating. You can try that. If it works for you, fine. Or what I suggest is that if you have a long distance relationship, probably two of you find about maybe 2 or 3 months, you can stay together and have sex together. Maybe that will help. That's my best advice. You have discharge almost every day, just like egg whites. You can't tell if you are ovulating. This egg white business, forget about it, Jerry. Yeah? Egg white business is for kids. Egg white talk is for kids. Okay, I don't talk about egg white. It's total waste of time. Egg white. What's egg white? I don't know. No, I don't deal with all that thing. Egg white is for kids. It's a secondary school talk. You want to get pregnant, have regular sex. Don't wait for egg white. Egg white, call. Egg white me. Have regular sex. Eh? Let us talk serious thing. Doctor, what causes hotness and waist pain in early pregnancy? Is the womb getting bigger and stretching the ligaments? The womb is supported by 4 ligaments, 2 in the front in your groin and 2 attaching the womb to your backbone. As the womb gets bigger, as baby gets bigger, there'll be stress and tension on those ligaments, and they can cause pain and discomfort. That can happen. That is possibly the cause of this pain you're having in early pregnancy. Look at this girl called James Martin. She's saying the pink lips is in that boski. Doctor, you like in that boski? What's in that boski? In that boski called, if I catch you, anyway, let us continue. And that's just a joke. Anyway, thank you, Jane Martins. God bless you. You have a friend that is seeing a period once after 60 days. That's not normal. She should check her hormonal profile, do ultrasound scan, and check if she has polycystic ovarian syndrome and get sorted. How long can someone take Bomegon? If you're taking Bomegon, you should take it for minimum of 4 to 6 weeks. Okay? And before you start taking Bomegon, you should have done prolactin test to know the baseline of your prolactin. It's common sense now. If you want to start something, you know what, you check the time. When did you start it? exam. Started at 6 o'clock. An exam is 2 hours. So you have an idea of time. So before you start taking the boom gun, you should have an idea. You have an idea. See, my window is open. So all these flies are entering. In fact, there's been so much fly surge in UK now because of the warm weather. So I had to open all the windows. I can't believe it. And you can see flies everywhere. So, see, before you start taking gun for prolactin, you must know your prolactin level, what it is. People can't see me on Instagram. The network is bad. You see, I don't know why I have to call my network provider because this is my office. And whenever I'm in my office, my Instagram is not very, very strong. So people can't see me on the Instagram page. Let me move my phone this is my Instagram phone to the door. Maybe people will see me. Can everybody see me now on Instagram? People can't see me on Instagram because my network is not good there. But they can hear me though. Oh, I think I touched my phone. I touched my phone, and when I touched the phone, the camera went off. So on Instagram, apologies. I think my finger touched my phone, then the camera went off on that Instagram page. So I'm back live on Instagram. Once again, Dr. J here at ATG. Okay. So somebody saying, there's a question here on on Facebook. Doctor, please, is it that someone with one unblocked tube cannot get pregnant? No. If one tube is blocked, as far as the other one is okay, you can get pregnant. Okay? If one tube is blocked or removed or damaged for any reason particularly, and the only tube you have is perfectly okay, it's not blocked, you can get pregnant 67% of the time. As far as you're ovulating, you can get pregnant. The only thing is that if that tube is also, if all the tubes are blocked, wahala, okay? But if both tubes are, if one tube is okay, you're ovulating, you can get pregnant. But if you get pregnant, we do scan as soon as possible, around 6 weeks of pregnancy, so that we know that the pregnancy is not stuck in the tube like ectopic pregnancy. Can everybody see me on Instagram? If you can see me on Instagram, can you give me thumbs up? If you can see me on Instagram, please, can you give me thumbs up? If you can see me on Instagram, can you give me thumbs up? People still can't see me on Instagram. Okay, like that, good. Lawrence, Audi, can you see me live on Instagram? If you can see me, let me know. I think people can see me now on Instagram. So let us continue. So, Tony Godfrey Alufokai, she's saying, Doctor, you feel hot in your fallopian tube during flushing. Oh, doctor, must I feel hot in my fallopian tubes during flushing to show it's functioning? No. If you have tubal flushing, okay, what you should do is that you should do HSG afterwards to check if the tubes are patent. So you need to do. Doctor, please, cause of pain on the left side of stomach after treating infection. You've done ADS and you've taken treatment. If you're having pain on left side of stomach, get a scan to check that you don't have ovarian cyst that is just coming up. Thank you. I don't think I ovulate, cause I lactate. Okay, now that is a lady called Jesus gone. I was trying to see that question, but it's gone all of a sudden. So fast, so fast, so fast. Let us go back to Instagram. Any questions on Instagram? No. Back to Facebook. Now, there's a question here on Facebook. Doctor, can someone who has adenomyosis get pregnant? Yes. How long can someone take Alalade for hypolactin? In Nana, I've answered this question today twice, and I'll stop answering the question now. See, before taking medications for hypolactin, you must do your prolactin level, okay, and take the medications for at least 4 to 6 weeks. At the end of the 4th or 6th week, do your prolactin level check again to see that it's come down. If it's not coming down, it's time for you to increase the dose of medication or add another medication. All this must be done with your doctor so that we know what medication you are on, what we are changing it to, or what we are adding to it. Case closed. You gave birth to a child last year through C-section. Since then, you've been trying to get pregnant, but nothing's working. What can you do? First of all, do HSG. Secondly, do ultrasound scan. Thirdly, maybe you might need hysteroscopy and also check your husband's sperm count. A question says that I don't even think I ovulate, cause I lactate. Onyechi Perpetua, I've answered you already. Your prolactin level is normal. What should you do? Why don't you check your other hormonal profile? Why don't we check your other husband's sperm count? Why don't we check your tubes? Okay, and if everything is okay, you're ovulating. The next thing is you have regular sex every 3 days, and also add Pristine lubricant while you're having sex. It increases your chances of getting pregnant by adding Pristine lubricant during sex. You won't believe it. It works. Someone's asking the question, what's the treatment for adenomyosis? The treatment for adenomyosis will make you not to get pregnant. Most treatment for adenomyosis are hormonal based, and those hormonal based, they will knock off your ovaries so that your ovary does not produce estrogen. And whenever your ovary is not producing estrogen, you're not going to get pregnant. So for trying to get pregnant, leave adenomyosis alone. If you're trying to get pregnant, just forget about adenomyosis and focus on your tube that is open, focus on your ovary that is ovulating, focus on your husband's sperm that is okay. As for adenomyosis, leave it alone. Okay? If you have fibroid, more than 4 centimeters, take it away. Doctor, your period lasts 4 days and small spotting on the 5th day since your first baby. You only flew for 2 days, something like that, and it's gone. I can't see that question again. Sorry, that question is gone. You're from marriage CH, you're from Pakistan. 1 year, my shudi bought no baby, something help me. I don't get that question. Okay, there's a question here on Instagram by Awele Johnson. How do you use Pre-Seed? Pre-Seed lubricant is very easy to use. You know, that quantity you put on your toothpaste, you see, when you squeeze a tiny paste on your toothpaste, that same quantity, the same thing for Pre-Seed, a very tiny quantity, about as tiny as your finger nail like this. Rub it in your vagina inside, not on the skin, no, inside vagina, or put it around your husband's erect penis before he goes inside with his condo. That's all you need. That's all you need. It's easier if you rub it on your husband's erect penis before he inserts. So always keep your Pre-Seed lubricant by your bedside before sex, okay? His condo is bola like this. Just rub it. Press plenty. Rub it. Your husband, this thing will go in through inside your toto. Easy peasy. And it makes the vaginal environment conducive for sperm transport and sperm mobility, and makes getting pregnant faster and easier. Shadi Oji, thank you for being here. Doctor, you've sent your question twice. I didn't see it. Send it again the 3rd time. Let me see it. Thank you, Bridget Nana. Thank you so much, Oyinyeji Perpetual, for answering Bridget Nana. Can one take metformin to regulate period due to PCOS when trying to conceive? You can, but it must be given to you by a doctor, and they are monitoring your glucose level so that you don't run into hypoglycemia that can kill you. So metformin is to be taken with care. It can kill you. Doctor, what's the meaning of pelvic adhesion? Pelvic adhesion means that you have like scar tissue under your tummy, around your ovaries, around your tube, around your womb. There are scar tissue there, like cobwebs there. That is what pelvic adhesion means. What causes them? Previous infection can cause them. Previous operation can cause them, okay? Or previous fibroid surgery can cause them. Doctor, at what point can one experience cramp in ovulation? I don't know. I don't know at what point you're going to experience cramp in ovulation. Answer my question now. Abba, 2 questions. Ebube, Favor, what's your question, my sister? Maybe I missed it. No, I'm not God now. As you're asking me a question, I'm focusing on you on Instagram. I only have 2 eyes. So, as you're asking the question now, maybe I didn't see it now. So, ask me again so that I can answer. As I'm answering one, another one is coming. How many can I answer in a second? Before I even answer one finish, another one is coming. So, I have to take it easy now. God bless you. Okay. Geoffrey Alokai, I've already answered your question. Let me answer other people too. Somebody says a lady called Mercy Gold. You bloat something in your stomach. What causes it? Maybe you're taking too much ice cream, too much yogurt, stuff that contain milk. They cause bloating. Or probably you have endometriosis or irritable bowel syndrome. So avoid all product containing milk. Avoid all canned milk. Avoid all ice cream. Avoid all stuff anything that contains milk. Avoid beans. Okay. Egbo Amara. What's the question? Hello, Nosy Secrets from Instagram. Welcome and good evening. Let us fire on. We are here. I'm here for you. I'm here for you on Facebook. Please ask your question. Okay. Can one take metformin to treat ovarian cysts? No. Metformin is not for ovarian cysts. Tony Godfrey, you are at 44 years old, pregnancy decline. Doctor, please, what is the meaning? Oh, it's gone. I don't know what you mean by pregnancy decline. No? Kanu Kelechi, I've already answered your question. Doctor, why trying to have a baby boy? When should you have sex? I don't know. Does anterior placenta affect baby's kicking? No. Anterior placenta does not stop a baby from kicking, but it will reduce your perception or the feeling of you feeling your baby move. Whether you have anterior placenta or posterior placenta, baby will still move. It doesn't stop baby from moving. But because it's anterior placenta in the front of your womb like this, you might not feel the movement, but it's still there, okay? You will still feel it if you are gentle and you're calm. And if you're about to sleep, you'll feel baby kicking as far as you are paying attention to your body. But because the placenta is in front, anterior, which is nothing bad, you'll not feel the movement as strong as someone that has a placenta on the side or on the back. What can one take for uterine prolapse? Exercise. There's no medication to treat uterine prolapse. Uterine prolapse is when your womb attachment is getting weak and is protruding in your vagina. Your womb is being shifted and is protruding in your vagina. That is uterine prolapse. There's no medication for that. It's surgery. You did HSG. You discovered you have fibroid, okay? And that your right tube is blocked, which you've gone for operation now. For 2 years now, no pregnancy. If you have fibroid, okay, more than 4 centimeters, it should be removed. If your right tube is blocked and your left tube is okay, and you are still ovulating, you will have gotten pregnant. That means that there's something else wrong. Your right tube blockage is not the reason why you're not getting pregnant. Check your husband's sperm count. Remove that fibroid and check again whether that left tube is okay. There'll be an answer. If there's no answer, then there has to be IVF. But there's something wrong somewhere that has been missing. Chinonye Rosemary Eziora, what's your question for the 5th time? Someone's asking a question, why do Gynae ask you to come around your period? There must be a reason. Probably there's a test they want to do for you around your period, or maybe they want you to do HSG around your period. I don't know. But there must be a reason why. So it depends on the test. For example, if I want to do your FSH and LH, I'll tell you to come between day 2 to day 5 of your cycle. If I want to do your HSG, I'll tell you to come a day after your period ends, and I'll do your HSG. So there must be a reason. Doctor, please, do I have pregnancy symptoms during ovulation? No. If you're ovulating, you don't have pregnancy symptoms. Thank you. What is the cause of pain during breastfeeding? As you're breastfeeding, your body is secreting oxytocin, and it makes your womb contract. Help my friend conceive. Let your friend come and ask a question herself. How can you be asking question for your friend when people here, they've not even asked their own question? You're asking question for the third party. Blessing, Ugwa, you're asking a question for your friend that is not here. Why don't you let people that are here ask their own question? How long can someone that did fallopian tube canalization get pregnant? Tomorrow, today, yesterday. Once your tube is been unblocked, if it's really been unblocked, you will get pregnant if you're having sex. So thank you everybody for listening to me today. I cannot answer every question because I'm human. As I'm answering a question, someone is asking another one. So everything is moving fast. And sometimes Facebook moves so fast too. Another issue is that I can't just answer every question. I'm human now. If your question has not been answered though, join our premium service and let us attend to you. For those watching me on Instagram, my phone on Instagram is dead. I should have plugged in my charger on that phone. People watching us on Instagram, the phone is gone. So I'll be here again live tomorrow by God's grace. And tomorrow by God's grace, and we'll be here talking about gynae stuff. Okay, God bless you and have a wonderful weekend. Have a wonderful day. Back at the salad to everyone as well. Bye bye.